Ever watch one of those prescription medicine ads where everyone's smiling, jogging in the park, having a great time with friends, and somehow distracting you from paying attention to the voiceover that's listing off all of the side effects, like dizziness, nausea, sleeplessness, thoughts of doing yourself in, kidney failure, seizure, stroke, coma, or worse. Or maybe you've left a doctor's appointment wondering if the treatment suggested was really the best fit for you, or just the quickest option for them. If you've ever felt that nudge, that pressure, that moment where you weren't sure if you were being guided or manipulated, well, you're not alone. I get it. When something this personal is happening, you just want to get it gone now. I've felt that pull toward the fastest fix too. Just so you know, what I'm sharing comes from personal experience in interviews with patient advocates. It's for education about communication only and isn't medical advice. Always consult your licensed clinician about your symptoms, diagnoses, and treatment options before making a decision. Now, let's talk about how advertising often uses emotion over facts. Sure, they'll show you happy families, attractive actors and actresses, instant results, followed by that rapid-fire list of risks. And here's something I want you to think about, as if you were my own family member. So much of what we see in healthcare and in advertising pushes a cure now mentality. The message is, you need relief right away, and this is the only path to get it. But here's the truth. Quick fixes often hide bigger trade-offs. When you feel pressured into rushing a decision, whether it's starting a treatment, filling a prescription, or following the latest breakthrough ad you saw on TV, you lose the chance to ask the questions that matter. Questions like, what are the side effects? What are the alternatives? How does this fit with my other medications or my lifestyle? Speaking up slows things down just enough to make sure the decision is right for you, not just right for the system or the ad agency. Providers may unintentionally frame choices in ways that limit options. They might tell you that most people do well on this medication instead of laying out alternatives. Miscommunication isn't always intentional, but the effect feels the same. You walk out unsure if you made the right choice. Here's a real problem. When manipulation replaces clear communication, your health decisions aren't fully yours. You risk unnecessary stress, treatments that might not fit your individual needs, or ignoring safer alternatives. So how do you recognize when that's happening? Well, let's start with spotting manipulation in the ads you see every day. Notice the emotional cues, smiles, laughter, perfect life images. Pay attention to what's rushed, the side effects list. Ask yourself, if this ad didn't show actors, what would I actually know about this treatment? But it's not just commercials. The same kind of subtle persuasion can show up in the exam room too. Listen for phrases like, most patients just do this, or this is the easiest option. That's framing, not facts. Facts include risks, benefits, and alternatives. It's a simple fix. Respond with, what other options are there? Or, what are the risks if I wait or do nothing right now? And here's where you take back control by shifting the conversation so it works for you. Use I statements. I want to understand the alternatives. Clarify the urgency. Is this something that needs to happen right away, or do I have time to consider? Repeat back what you hear. So you're saying the benefit is quicker results, but the risk is stronger side effects? Is that right? So whether it's an ad on TV or a conversation in the doctor's office, you now know how to spot the signs and redirect the discussion. You can't stop ads from trying to sell you something, and you can't stop providers from being influenced by time, training, or even outside pressures. But you can protect yourself by knowing the signs and steering the conversation back to facts. Because at the end of the day, you deserve more than persuasion. You deserve clarity. And in this next video, I'll show you how to speak in a way that makes healthcare providers truly hear you, so your care reflects your individual needs. Thanks for watching. I'll see you online soon.